Good afternoon, ladies and gentlemen. This is David Sutter with the High Table, and we got a special guest today. A good friend of mine I met about 4 years ago. We both pledged Omega Psi Phi Fraternity Incorporated. And this is by far, I always brag about how smart he is. Has to be the smartest man I've ever met in my life. He's a doctor. He's a family man. He's a lot of other things. But he's a man of Omega. Again, we would study together. We'd be at our harvest ball singing. We do our thing. We do our thing.
That's right. Yep.
I'm being silly. But it's good to have Dr. Kevin Billups here. How you doing, sir?
I'm doing good, David. Good. Thanks for having me. Looking forward to it.
Well, introduce yourself. Tell the people a little bit about you.
Okay. So, Kevin Billups, Dr. Billups, I am a physician, so I'm a urologist by training, but I haven't done the kind of general urology for a while. I grew up in Baltimore. That's where I grew up. I was actually born in New Orleans, but we moved when I was 3. So Baltimore is really home. So I grew up there. I did my medical school at Johns Hopkins, my residency in urology at Johns Hopkins too, which was actually nice being home.
Right.
And then I did a fellowship, so kind of a specialty at University of Virginia, where I kind of specialized in sexual medicine and reproductive medicine after my urology residency, and kind of went from there. From there, spent some time in Minneapolis. When we think it's cold down here, it's not really it's not really cold.
Right.
Came back to Hopkins for a bit, and then actually have been in here at Meharry, where I'm a professor now at Meharry, for going on 11 years now. So, my practice is really a men's health practice, and it's almost like a preventive health practice for men. Right. So it kind of evolved, and I don't know if you want to get into that story about how it evolved, but yeah, that's kind of in a nutshell. That's where I am.
I told you he was smart. Okay, I told you he was smart, but I want to get into your background a little bit. And of course, we're going to get into the men's health. That's why I wanted you to come. But what made you gravitate towards education? Because I hear you talk about a lot of high-end universities that you really have to do pretty good to get into. What kind of gravitated you towards education early on?
Well, both my parents were in education. So my dad was a high school principal. Started out at the middle school, then high school. So we never got away with anything at home. Both my parents were. There was no question what was expected out of us. My mom was an educational specialist, again, both in the school system in Baltimore, and so that kind of got us going. That was always a priority for my parents, and I just kind of followed suit from there, myself and my brother. So that's really kind of how I got in the path.
Right, and so the expectation was very high in your household.
Yes.
Just to barely pass or having good grades.
No, the expectation was you to have good grades.
Right.
Both my parents did well in school, and my father was actually the first one to go to college in his family. He grew up in Kenner, Louisiana.
Okay.
So, and my mother was in Virginia. So I won't say there was pressure to get straight A's, but the expectation was you were going to put your time in.
Right. Absolutely.
And I remember one time when I didn't do that well in school, and my father was a math teacher, I didn't do that well in math. And, so I got the opportunity to have Sam Billups summer school. Yes. I was the only student in summer.
Oh my God. Everybody having fun.
Everybody having fun.
Right.
And he was like, oh no. And after that, I was like, I got that message. Okay. There won't be any more opportunities for this.
There'll be one time. Ruined my summer one time. And then I got it from that point. And so were you a good student in high school?
Yeah, I was. I was pretty much straight A in high school. So,
okay.
So I liked science. I thought I was going to be a doctor early on.
Okay.
And so that kind of spurred me on. Yeah.
Wow, that's amazing. And so, were your immediate friends as smart as you? Your close friends, your buddies?
I probably had, I went to it was a private school outside of Baltimore, St. Paul School for Boys. It was small, very, very small class. It had a variety of friends. I played sports there. I played football, varsity football for 4 years.
Oh wow!
And
in what position?
Tackle. I was, and those were the days when we went both ways, right?
Yeah.
So I was offensive and defensive tackle, man.
You never left the field.
I never left the field, man.
Wow.
Then they put me on kickoff teams, and I was like, man, I got to get some time to get off the field.
You played when it was very physical.
Yeah, it was a whole. Oh yeah,
my goodness.
It's very. We didn't have all those fancy uniforms or anything either.
Yeah.
White pants and a blue shirt. I mean, that was it. So, but I enjoyed it. It taught me. It taught me teamwork. It taught me not to give up. Some of those days on the football field when you just felt like this is hard, and so I played in high school. I didn't play in college.
Okay.
Last few years in high school, I was getting kind of I think I hurt my ankle pretty bad one year and the back, and I was just like, what. But I'm glad I did it. I'm and the opportunity to actually get out there and play. I like offensive tackle better than defense. I loved offensive tackle.
Really? Okay.
That's a thinking person's position. Man.
Right. So, they say that the center and the tackle are the smartest guys on offense because they got to know the signals.
You got to know all the signals.
All that stuff.
That's right. And I'm telling you, the years the running backs know when the line is not in sync because my freshman was the only year I went one way because we just had. We had a pretty stacked team there, and I was 6'3". I've been 6'3" since like 7th grade. 6'3".
Wow.
And I was 200 pounds, and they called me tiny.
Oh man.
Because I was the smallest one on the line. So that was a fun year. Yeah.
Wow. And so going through high school, you knew that you were going to be a doctor. What made you choose the colleges that you chose? Because I'm sure with your grade point age, you had a plethora of schools to go to.
I did. And so I looked around. So I ended up going to Harvard undergrad. That's where I did my undergrad. Harvard. Hold time out. Okay, carry on. So and I looked around at some of the bigger Ivy schools and also some of the smaller places, smaller colleges. And I actually thought I was going to go like to a place called Haverford or a place called Princeton. They were smaller. But then I actually visited Harvard last.
Okay.
And one of my cousins, or my godmother's son, was actually there at Harvard, and we had a good time up there. We went, and so I came back and I was like, I think I want to go here. So that's how I chose it. That's how I chose it.
But these schools that we here in the South is being like just the Taj Mahal of colleges. Yes. Not many people from Nashville went to Harvard. I know maybe a couple of guys that went to Harvard and loved it, spoke highly of it. And so let's talk about diversity at Harvard. Mm-hmm. Okay, you coming from a black area of Baltimore. Okay, it's blacks everywhere. Then you go to Harvard. Did you feel any pressure being like the only black in this area? So
I actually didn't, probably because when I was going through high school, my high school was predominantly white, even though I had several good black friends. Matter of fact, our crew pretty much integrated that school, man. I mean, we were, and it's been nice to look back.
Right.
Because I'm coming up about this summer, my 50-year high school graduation. So it's interesting to look back and to see the number of black students they have now. And to think like, hey, we actually started this. So Harvard, it was kind of what I was used to. But I will say this: we had a really good African American organization, black student organization at Harvard. So yeah, you were there, and you were always in the minority, but we had a good group, and had weekend parties, craziness, and all that kind of stuff too. So it turned out okay. It turned out fine.
And so you get in there. Well, is it competitive? Like academically competitive? You being a doctor fighting for that position and trying to get to that level, how much competition was it?
So there's a lot. So a lot of competition, and what I remember, what I distinctly remember, you come out of high school. And this is true a lot of places. You come out of high school and you kind of top dog, right?
Right. Exactly.
You valedictorians or whatever, and then you come. You go to a place like Harvard or other, and all of a sudden, you good, but so is everybody else.
Right.
And so it's a level up in intensity, that kind of freshman year that unsettled me a little bit because you're used. But then the thing I learned was. There's a lot of gamesmanship that goes on. People will be studying, leaving their room, putting something under their door, especially pre-med. Pre-med, very, very competitive. Some people putting towels under their door so they look like, I'm sleeping at night doing that. They're staying up all night studying and stuff like that. So you just kind of learn, though, to have confidence in yourself. That's one of the big things that I have to credit my high school with. They prepared me well because what I saw my first year at Harvard, it wasn't anything I hadn't seen before.
Right.
Term papers, long exam. Right. So that part didn't shake me at all. Right. It was more just getting used to the competition, and then just also not getting psyched out and kind of learning to believe in yourself.
Right.
Yeah.
Right. And so speaking of diversity, I went to Tribeca. And my brother went there. And so when I got there in '88, it was like minimal African Americans.
Uh-huh.
And what was crazy, there were some people there that had never seen a black person in person other than on television.
Really? Oh, wow.
So that context was, some commercials, cops.
Uh-huh.
You know what I'm saying? It's kind of a bad, a context of African Americans. And I could feel it, and we could go into that. But it's kind of difficult at first. Not being around a lot of white people.
Yes.
We had some conflicts, not major, but just some deep conversations, just trying to smooth things out a little bit. So you get to Harvard, you're in competition, and then you start to excel. How did that make you feel? Like now you come in as a nervous freshman, not really knowing the landscape, and then you take over the landscape.
Yeah, and I did, I certainly wasn't a straight A student or anything like that at Harvard. I did well, and along the pre-med track, I was a biology major.
Okay.
And I knew I was going to go ahead and apply to medical school. And like I said, we had a great pre-med, kind of black pre-medical student, really supportive. So a lot of stuff that a lot of things you needed to know how, kind of know the ropes.
Right.
They were really good at that.
Wow.
Like I actually had one instructor at Harvard, tell me, don't even bother to apply to Hopkins because you're never going to get in there.
Wow.
And if you're young and don't know, you're just like, oh my gosh. But then you go back and we had one of our pre-med meetings. They're like, man, forget what that guy. Right. They're like, don't even let that shake you.
Wow. So what age was this? Like what years was this?
So let's see. That would have been, I graduated. When did I get out? I 80. Yeah. Because I graduated high school 76. I graduated Harvard in 1980.
Wow.
And then Hopkins finished there in 1984, finished medical school, and then finished residency in 1990.
Wow.
Yeah.
That's a lot of school.
It's a lot of school.
That's a lot of school.
It's a long time.
Yeah.
It's a long time.
But what kept you engaged? Like your inner drive that you have? Because that's a lot of school. You didn't even mention undergrad. You just saying
right. I just after, with the well, a part of it is it's the pathway that you have to take to get where you want to go.
Right.
And so that kept me going. I enjoyed for the most part the different studies and things that I did. Mm. I was fortunate that I was able to kind of march through it just in the order I said, right? I mean, I've met a lot of students who they had a lot more had to deal with life, with taking care of family and other things, and they still ended up making it through, but they had a lot of other stuff to worry about that for me I was able just to keep marching through. So
wow.
So Yeah.
Okay, and so you graduate from John Hopkins,
Hmm.
and now you're into men's health, or was it initially, or did it? What kind of led you toward that path of men's health?
Yeah, so I didn't start out with you know, when I finished medical school, went into urology. So I finished medical, went into urology. And you know, when you first go to urology, urology is a surgical subspecialty, right? I mean, we do surgery on the prostate, the bladder, things like that. So like most people coming in, I was gonna go in to be a cancer surgeon. I was gonna be the world's greatest prostate cancer surgeon, you know, and go in. And Hopkins was actually it's kind of the home of prostate cancer surgery. So, but when I got in there, I just didn't really enjoy all those big surgeries the way I thought I would. So I was like, okay, this is not something I'm going to do. So I got one of my mentors was into it was actually into male reproduction, kind of male infertility, stuff like that. So that's what I spent some time doing that. Decided I would do a fellowship. I did a fellowship in the infertility, but also erectile dysfunction, low testosterone, all that kind of stuff. So that kind of kind of steered me off of that. And then when I finished my fellowship and took my first position because at University of Minnesota actually, so that was in Minneapolis.
Cold Minnesota.
It was cold, but they put me in the clinic for men with erectile dysfunction.
Okay.
And the reason I got assigned because I was a junior faculty, I was a low, and because we want surgeries, right?
Right.
There's not a whole lot of surgeries in erectile dysfunction. So, but when I was in there, I started seeing men 40s, 50s after they had a heart attack, after they had chest pain, and they were coming to me for erectile dysfunction. But I said, when did you actually start having this problem?
Right.
And these guys were telling me they had ED 3 to 6 years before they started having their heart problems. Wow. And that interested me. And it just so happened I had all this vascular training. So I just started hanging out with cardiology. And I was like, look, there's got to be more going on here than and to kind of jump ahead, that's well known now. But if you look at some of the early papers, they were done by the group there when I was in Minneapolis and St. Paul. So that kind of got me going in a whole different route.
Right.
And then that kind of branched into, how do you get men to come into the doctor, right? I mean, because we delay everything. But I tell you one thing we do care about.
What's that?
We care about those erections.
Yes, we do.
We care about our testosterone.
Shout out to the
We care about our prostate health. Yes, those three things alone get people in. But then my practice kind of evolved into more of a preventive practice for men. I started doing stuff with the latest thing is with lifestyle medicine, with food, diet.
Okay.
I got board certified a year ago in lifestyle medicine. So that was my second board. And that triggered off me having some of my own health concerns.
Right.
And, so yeah.
Wow. And so now you're dealing with men. Let's talk about this because I really want to talk about this.
Okay.
Men's health. What are some of the keys that cause erectile dysfunction? Just kind of a thin definition.
Oh, sure. So a thin definition is erectile dysfunction is you're having difficulty either getting a firm erection or keeping a firm, hard erection. So most people think erectile dysfunction is if you just can't have sex anymore. You can't get an erection. That is really like end stage ED. The earliest symptom that people don't really realize, don't recognize, is you lose your erection too quickly. So I call it flat tire syndrome, right? I mean, you can get started and it just goes flat on you. And everybody start out.
Hold on. I gotta give you a hand. Okay, carry on.
Because men understand that. You say flat tire, and that's the earliest marker. Now, if that's when you should be coming in to get some help. Because if you come in then, you ask me what causes it. Well, the most common cause, diabetes, prediabetes, diabetes, high blood pressure, heart disease, if we're overweight or obese, cholesterol issues. Right. Stress and anxiety can cause it too. But the false thought out there is that, most erectile dysfunction because you're tired and stressed and anxious. No, most of it's medical. But here's the thing: you can have diabetes, high blood. You can have every medical thing in the book, have clear-cut erectile dysfunction, medical. If you're a man, do you think that's not going to stress you out?
Absolutely.
So everybody has the stressful part, right?
Right.
But it's a medical thing that's there. And the biggest message I always tell men, when you talk about why do you get it, those different problems,
right?
A lot of that can be changed with your lifestyle, how you eat, sleep, exercise, all that. So, that's what a lot of guys that I've noticed in my practice. You get in there, and everybody wants everybody wants the pills, right?
Right.
And the pills are fine. But the thing I tell them is, look, if you do some of the other stuff I'm talking about, I can probably get you off of that pill.
Right.
And by the way, get rid of your diabetes, high blood pressure.
And we're gonna get into that too. And so I gotta be transparent.
Okay.
I gotta be transparent. I can recall when years ago, I can't believe I'm saying this, but when my body started to change.
Yes.
Okay. And then I noticed that my erections wasn't as hard as they once were.
Yeah.
And I can recall early on in my 20s where it just wouldn't get hard. Right? So is that when it started, or that's just?
So when you're in your 20s, you probably, some of that might have been stress and anxiety. But then, what we have to look at is if you look at just kind of American. So if you look at the chronic medical problems people have, let's just say high blood pressure. So 50% of adults in this country have high blood pressure. And if you're being treated for high blood pressure, and it's under control now, you still have high blood pressure. You just have treated high blood pressure. So if you look at diabetes or pre-diabetes, that's another 50% of people. If you look at being overweight, obese, that's 75%. So a lot of people have underlying things going on, and the erection problems can be an early warning sign. And that's the message I leave that I really talk about. It can be an early warning sign. So if someone comes to me with erectile dysfunction, I look under the hood. Just look at now. In your 20s, if I give everybody the benefit of the doubt. Like I don't just say, oh, you just head case. I can tell honestly when I talk to you,
right,
if it's going to be mostly a stress thing, but I still will do the evaluation because part of de-stressing the situation is to say, I have looked at this, and this on your medical. Right. I don't see anything there, and then we start talking about what kind of stress are you under, right. What's your sleep like, things like that. So yeah.
Yeah, and so you think men are embarrassed by it, or are you because you have a great attitude for black men to even come to the doctor?
Yes,
I think we should raise the flag for them.
Yeah.
How are they in that moment? Are they just embarrassed, or do they want the pill immediately, or are they willing to kind of listen to the steps that you're laying out for them?
Yeah, that's a good point. Like when they come in, so I would say some men are embarrassed. A lot of men delay, right?
Right.
Even a lot of men in relationships, they'll wait until things just get bad, and then they'll come in and they're like, man, things are about to break up. What can you do? So when we delay, there is some embarrassment. There's also just a lot of it's a blow to the male ego, right? That's why men don't want to admit this. Right. They're like, oh man, because that's like a blow to your manhood. But what helps, what I say right away is this is most likely due to a medical condition. So like if I see a guy who's got diabetes or something, and when I ask him about erectile dysfunction, and I teach this to my medical students, because a lot of people, they're very hesitant, like, I don't want to embarrass you. And I was like, you might be saving this person's life.
Right.
So, but the way I ask it, let's say if I see you got these medical problems that I know are probably, I'll say, oh, are you having difficulty getting or keeping an erection? But then right away I'll say, because I commonly see that in men who have this.
It's how you word it.
So I word, and then that diffuses it, and they're like, but the biggest thing, you talk about men not want to talk about this, was interesting. A lot of times men will come in and they want to talk about the erectile dysfunction, but they won't get to the point. And you're sitting there, and I'm going through the whole visit.
Right.
And then you're like, okay, well, we're going to come back. No, I was like, okay, we'll schedule you for another phone. And then as you're walking out the door, they'll say, wait a minute, doc. There's one more thing I want to. I call it the "oh, by the way" handshake. I'm shaking hands to get out the room,
right?
I'm like, oh my god. And then usually at that point, what I'll do is I'll say, let's reschedule you because I don't want to rush through this topic,
right?
But yeah, and so that's funny. So I've had two of my medical students who are residents now who told me, they said, Dr. Billups, you told us about that "oh, by the way" handshake. Right. And they're like, is that short? That's exactly what happened.
Well, social media doesn't make it better. Okay. It seems like social media is a young man's game.
Yes. Yes.
And they put down the older generation. Women put down the older guys. And so there is some pressure. But what I find with my friends is I'm very transparent with my friends. They won't admit to it, but they will acknowledge what I'm saying. So that's their way of saying, I know what you're going through.
Yeah,
you know what I'm saying?
Sure, exactly.
So we have like a policy with my friends outside of Omega. Listen, we don't joke about that because it's serious. It is a shock to our manhood.
Yeah.
But it shouldn't be. As we go up in age, things are going to change.
Things do change. And the other thing is, this can be corrected because it's interesting because, like I said, everybody wants to go on the pills and this and that.
Right.
But when I get people and I really talk to them about, like, look, this is why you have it. I was like, I can put you on a medicine. The medicine is going to treat a symptom, right? So you could be like having diabetes that's poorly controlled. I can figure out a way to get you an erection, whether it's with a pill or something more aggressive than that. But am I really doing you a favor? Because then you're going to have an erection and you're going to think you're okay. But all I've really done is mask the symptom that actually made you interested in doing something. I put a Band-Aid on it.
Right.
Meanwhile, everything is getting worse. And at some point, these medicines are going to stop.
Right.
So when I said, look, wouldn't it be better if we just got and fixed what's causing this problem?
Right.
And then, if I have to put you, if I have to put you on medicine, I'm not anti-medicine. If I need to put you on, but my attitude now, and this is especially with these testosterone medicines, if I have to put you on it, it's a short-term thing. My goal is to get you off of it in 3 to 6 months.
Right.
And that's the way. And you just got to talk to men sometimes. I found men will listen more now, but you got to just kind of be right up front and just, we don't like playing games.
No,
right?
We don't like playing games, and we just need somebody to, to raise their hand first in class.
Yes.
And then everybody's hand goes up.
Yes.
And really, it's not embarrassing. I'm 55, and I'll be the first to tell you, things don't move like it used to.
Yeah.
Like I tell you. You know what I'm saying? I'm in bed by 8:30 every night. I never thought that. I need 8 hours, 9 hours sleep.
Right, yeah.
Just
that's
to function.
Right.
Just to function.
Just to function, yeah.
And so now you're on this road to men's health. Do you view it as your calling now after all the things you've been through in high school, offensive tackle, defensive tackle, Harvard? This is your calling.
Yeah, I think it is because it's interesting. If you look at, like, it's the things you said. Plus, like I said, urologists are surgeons, right? I mean, my colleagues, it's about operating and doing things like that, and half of them don't know what to do, but they like, man, this guy just lost his way. He don't know, what's going on. But I really enjoy it. So yeah, I really do believe this is my calling. This is what I was supposed to do. With the communication bit, I've always, a lot of people tell me, you can take a complex medical topic and you break it down to where it's so simple that we understand it. Right. You're compassionate, you listen. So yeah, the communication bit is the calling, and I'm almost thinking more of the calling now. Part of it is, I still do see patients, of course, and we have some new clinics now where I'm training people to do more. But I almost think more of my calling is to be the voice to get to talk to people, to get them in. I've done so much of the treatment now. I can honestly talk to you for 5 minutes, less than 5 minutes. I already know. I know everything that's going on, what needs to be done. And the question is, how do I get you to do it?
Right. And so men, have you got much pushback from men when you tell them the truth? Hey, I know what's going on. Can you do A, B, and C, and D, and things can be better? Do they debate you? Do they quickly want to go on the pill?
So some men do want to go on the pill because that's the society, right? And you know all these commercials we have.
Oh my God!
Everything is the rapid, quick pitch pathway. But what I tell them is that may not be the effective pathway. But here's what I've also found. It's at some point men get what I call sick and tired of being sick and tired, right? And they're just like, I don't want to go on any more medicines. What can and those they're open then to actually me saying, look, there's another way. Now it's not going to be the immediate gratification. You're going to have to spend some time, but actually it's not that much time. Because I tell you, when you change your lifestyle, I've had so many men now taking life, especially what you eat, the exercise you're doing, the amount of sleep. You mentioned sleep. Sleep is huge. Things change rapidly. I mean, you can start noticing changes in your blood pressure and your cholesterol in less than 2 weeks when you change your lifestyle.
Wow.
And a lot of aches and pains, like you would say, when we get older, all those aches and pains, all that starts going away. Because and everyone wants to focus on the weight loss.
Right.
And so, I'll have guys come in and say, well, golly, Dr. Billups, I've been eating, doing everything you said for 2 weeks, and I haven't lost any weight and all that. And I said, okay. I said 2 things, 2 observations for you.
Okay.
How long did it take you to mess yourself up like this?
Right.
Oh, 30 years. Okay, so first of all, 2 weeks is ridiculous to even think about that. But then I said, let me ask you this. Have you noticed when you get out of bed, you feel better? Do you get out of bed faster? Do you have less aches and pain?
Right.
And they start thinking about that. It's like, yeah.
Ding, 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 ding.
And I said, right. So your body is healing.
Right.
And the other stuff is going to come, but you gotta stay with it. So I do get some pushback. But the biggest pushback I get is people say, I don't have time.
I don't have time.
I don't have time. And I said, well,
hey, listen, okay, I get that, but as we know at our age, you're older than me, time is just it's fleeting away.
Yeah,
we don't have time.
You're never gonna.
You're
never gonna be. And look, I was the same way when I started on this kind of lifestyle journey. It's been about 8-9 years for no, it's been more. It's been 10 because it started when I came to my hair. Okay. I came here. I had stressed myself out in my career. I mean, I was probably 50 pounds heavier than I was now.
Right.
Blood pressure, everything was going the wrong way, and I was managing myself because I'm a doctor and I'm a man. That makes me an idiot too. So I'm an idiot doctor on top of all this doing this. And a friend of mine just pulled me aside and he said, "Look, man, you got to come to this program I'm putting on. This on like." And I said, "No, I don't have time, and I'm not going to do. I'm not going to. I don't want to change.
Wow.
I got this. I will fix all this when I'm ready to fix it." Some reason I went, and maybe that was God looking out for me. I went. It was in Chicago. I think I went because I thought they had good restaurants up there. I could have food. So I guess so. But I went and I listened to this program, and they had doctors and people in the general. Everything was like based on evidence, and it just hit me. I was like, all right, I really can't ignore this anymore.
Right.
I mean, it's like, if I do, I'm so I came back, jumped in cold turkey, went in, decided I was going to change what I ate, and I honestly I thought I could do this and fail within a month, that I'd be back to my doing whatever I wanted to do. But it didn't. Things turned around. Lost like 35, 40 pounds. Energy, but everything got better. Everything. Then I started using it on my pay. I was like, well, this stuff works, man. Let me bring it into my practice. So I brought it into the practice. Same thing. Wow. Guys coming in with all these diabetes, high blood pressure, overweight, and having their erections and low testosterone too.
I got a question for you.
Yeah.
Is there a difference in white men and black men when it comes to erectile dysfunction, or is it the same?
So the cause is the same. I think what the difference in black men is that we have the worst health statistics of anybody, right? So we have a higher prevalence of diabetes, high blood pressure. So we have the risk factors that are higher. But the way you get erectile is, it's the same. The causes and all are the same. But yeah, that's if you look at the health statistics, that's more of why those different causes of it. Yeah.
Right. Yeah. And what I'm seeing now is a big uptick in men being transparent, being honest about what they're going through.
Yeah.
We live in a microwave society, and we want it done now.
Yes.
Okay. Let's talk about one of the many programs that you have started. You talked about you use it on yourself. You lost 35 pounds.
Yeah.
Was it hard to get your colleagues on? Like, you come back from Chicago, you come back here with this new information, and I'm assuming doctors are hard-headed because they're doctors.
Yeah. So yeah, it's been difficult. Well, look. So a couple things. In medical school, I don't think I got any nutrition training in medical school. I mean, maybe one class.
Right.
That's kind of changing very slowly now. So that's one thing. As doctors, we're educated to treat you with medications.
Right.
And so that can be a bit of a transition. One of the best things that happened to me was one of my one of my patients. You want to know who I'm talking about. Who's a good friend now. Actually, he helped me. He started a lifestyle medicine education company called Heal 90.
Okay.
And it started out with, hey, why don't we do a book club? He said, why don't we do a book club in your clinic to help to get men in better health?
Right.
And I said, there's no way in the world it's going to work.
Right.
I said, this is a waste of both of our times, but I did it. And we had guys showing up at this book club. I mean, it was a year-long book club. So we did about four or five books a year. And then everything progressed. So Heal 90 started out that way. Then it progressed to a 90-day program.
Right.
Then it got into a year-long program.
Right.
And then what happened was my new position at Meharry now, Meharry has very recently, well, a few months now, acquired 8 primary care clinics. So we have 8 locations.
Wow.
4 of them in Nashville, around, and then 4 of them in the Memphis area.
I go to the one on Clarksville Highway.
Yes. So this is that's Nashville General. This is Meharry. These are new.
Okay,
These are new. I'm telling because here's the interesting thing that happened. I always had that education program, with Heal 90,
yes.
That education side, and we will always be identifying people who needed to have medical treatment for it. So if you go through the program and you have diabetes, high blood pressure, different things, and we're working with you on education,
right?
And you still you need to still have a physician in. So what we have now, and what I'm really excited about, is this next phase. We started a program that's called the Restorative Health Program. So these practices are what's called Meharry Health Network. And what does that mean? So we've actually fully integrated the Heal 90 lifestyle medicine approach with the clinical practice piece.
Okay.
So it's a full program where we're really trying to use lifestyle as a way to treat chronic disease.
Got it.
And put that and put that for and people can look up Heal 90. We can get them that, and you can see all about it. So that's exciting. That's a new. It's exciting for Meharry. It's exciting for me. It's exciting for Heal 90. I think we can really make some changes, in every community, but I think especially in the African American community, because like you said, black men are looking for black. That's just a fact of life.
It's just the pressure.
Yeah.
And it's the pressure of being black, period. But then you take away that one thing that we can lean on, a little bit.
Yes.
Then it just adds added pressure. But again, like I said earlier, my friends, when we talk about it, they don't talk about it openly. They just acknowledge certain things will let me know.
Yes.
You have had a bout with it.
Yeah.
And so I'm a transparent person. If you see me on Facebook, I tell everything. And I'm not ashamed anymore. I'm 55. I'm not the only one to go through.
Well, everybody goes through, and you're right. And that's the thing for people to realize. The other interesting thing about erectile dysfunction is it isn't a silent symptom.
Okay.
Your partner, when you're having ED, you're not hiding nothing.
Right.
And it's funny. I talked to a bunch of women. They're like, "Oh man, no, we know." And honestly, I get a bunch of men that coming in because why you? Well, she told me I better come in here and do something.
Right.
Yeah. And sometimes the women come in And I'm getting more information out of them than the guy. They're sitting there, and finally I was like, well, let me just talk to her and get the story, because obviously you're not going to,
So you have, well, see, that's not bad, though. That's not bad.
No, that's actually good.
It is good.
It's good. It's good, and it's funny sometimes, because, sometimes I'll position them so the guy's up front, and his wife or partners is sitting by, and I'll say, so how long has this problem been going on?
Yeah.
Oh, about 2-3 months. And she's back there rolling her eyes.
Yeah. That's cold.
It is cold. I gotta have some fun.
That's cold.
That's all.
That's cold. But at least it's with your partner.
It is.
What I'm saying?
It is.
So it's what I found. Boy, I'm talking too much today. Lord have mercy. But what I found is that, I'm not with anybody that I don't trust like that. And so they're able to tell me, hey, this is going on, and and made me look at myself a little differently.
Yeah.
So I'm not Superman.
Yeah.
I had 2 hip replacement surgeries, torn Achilles, some heart issues. So it's a lot of, I've been cut on.
Yeah. Yeah.
Dislocated hip during surgery. Lord knows what they were doing to me during the surgery. Who knows? They was tugging on you, boy. But it made me more confident in my healing. Okay, I've lost close to 50 pounds. I'm feeling good. I want to go another 50 more. And so I try to be an example to my friends out there that may be afraid to say some things. You ain't got to lie to me, okay? But that person in the mirror knows everything.
Yes.
And it's nothing to be ashamed of. And so you and our frat brother, I can say Tony.
You can say,
Tony, y'all have a wonderful program, the 90-Day Challenge. Did you change it to Heal 90, or that's what it was at first, initially Heal 90?
No, so actually, no, that's a good point. It was a 90-day challenge, and then we changed it to Heal 90, which is the idea of your body healing itself in 90 days. Now, we always knew 90 days was not enough, right? But 90 days is enough for you to make a significant change and see significant effects.
Okay.
But then you really need to go. So our goal now is to somebody in the program is to keep you engaged for up to 3 years, because you really need. I mean, you're way down the road at a year, but we don't want you to kind of drift back into old ways. And it also depends on where you come in when you start too, right?
Right.
Because some people that have really significant things going on, and it takes a while. I mean, you got to, besides making the initial commitment, you got to. We try and meet people where they are, right? Because some
without
people,
judgment.
without judgment, and it's a change to change the way that you eat. Everyone can do it, but different people are ready at different times. Different people absorb information, more depending on what your medical condition is. From the provider side, I'll be a little bit stricter in terms of what you can do. Because nutrition and lifestyle is a huge factor in prostate health. So like prostate cancer, things like that. And a lot of men don't know, especially a lot of black men don't know that. But that's one of the best things you can do to protect yourself from either getting prostate cancer, or if you get a prostate cancer, keeping it at a low stage prostate cancer, and things like that. So education, and I think that's the biggest impact that Tony and I have had with Heal 90. It's just educating people.
Right.
So.
Yeah. I got a question for you. So, I have a friend that is a vegan, okay, and she stopped eating meat because her mother was struggling with Alzheimer's. It's just the early stages.
Yes.
Can talk about how the food has a influence on your body.
Yeah. So this is the thing with these processed foods that we eat.
Pay attention, people. Processed food.
You ever wonder why you can't put down a bag of potato chips? Because they got salt. They have fats in there, and well, chips don't have sweets. But those 3 things, they are addictive. Matter of fact, they are just processed foods. They can be just as addictive as a cocaine or opioids.
Wow.
So we can do MRI studies, and the same centers in the brain that light up with drug use can light up with food as
really?
Being addicted. It becomes. That's why you can't put down. You ever wonder why you can't put down a bag of potato chips? You open up that bag and you start eating those chips.
The whole bag is gone.
You're probably going to eat the whole bag.
Right.
And that. But what those processed foods do is they start something called inflammation. So they inflame the body. But it's not the type of inflammation you get when you cut yourself. Like if I go scrape myself, I'll get, it'll swell up, it'll get red, I might get some pus. That's an acute process. That's your body trying to protect you from infection.
Okay.
But these processed foods trigger a response where the body becomes inflamed all over, kind of a general inflammation. It's a low grade thing, but it damages tissue. So it's at the core of diabetes, high blood pressure, obesity, heart disease, all these different things. And a lot of it goes back to the food. So foods can cause you problems, but foods can also heal. So the Heal 90 program, what we really look at is called a plant rich.
Okay.
Now I didn't say V. It's plant rich.
Okay.
So you're eating vegetables. You're eating and it's in whole food. You got to be careful because plant-based. The word plant-based has been hijacked too.
Oh my goodness.
There's processed plant-based. You're talking about whole food plant-based.
Okay.
Good fiber. Our country is 95% fiber deficient. How do you get fiber? Way we used to. Good old fashioned, beans, any kind of beans, right. Things like that. So bottom line is you can get at this underlying low grade inflammation.
Right.
And now to get back to your question with the Alzheimer's and brain, the inflammation crosses the blood brain barrier.
Okay.
So the same inflammation is involved with is involved with some early cognitive decline, early changes. Yes. It can be even stress, depression, and with Alzheimer's. So yeah, one of the things you can do to really protect yourself is change the way you eat. You eat early on.
And so there's a direct correlation between processed food and Alzheimer's.
There's a direct, it's
not direct, but it's
right. I would say. There's studies out that are actually coming out and supporting that. But what I tell people is, because, people don't like looking at the end results so much. So I'm saying, look, even with your, what I call early cognitive function, like forgetting things, memory, that thing, you can, when you eat better with a better lifestyle, then that improves. But yeah, there are studies coming out that showing that correlation. So that's one of the major things that we can do to prevent. Because what you want to do is obviously you want to get something before you reach that end stage,
exactly.
right? So yeah.
Wow. And so, man, this is big for processed food. It's something where I think about Chick-fil-A.
Yes, okay? Yes.
You can smell the sugar on everything. Not just the lemonade, but it's good. And that's why it has to be something addictive because I've been to Chick-fil-A really all over the country. And the line has been long.
Yeah, it's it's fast food. It's just the way that's just what it is, and it's the battle of the taste buds, right?
That is true.
It's hard to fight the battle of taste buds. Here's one thing we talk a lot about at Heal 90. You can get healthy foods that really taste good.
Yeah, true, absolutely.
And you just got to be willing to say I'm going to make the effort and try. Get the right. The right train. Part of the reason that we put the whole Heal 90 program together was because, and I'll be honest, this way, but before I got into lifestyle, my lifestyle evaluation for you, if you were a patient, I'd be like, we talk and I say, you know what? I want you to go eat better and exercise more, and I'm going to see you back in about 3 or 4 months.
Right.
Now, and we're looking at each other like, I know you're not going to do anything.
Exactly.
And you're looking at me like, Doc, I like, what am I supposed to do? So we put this, education is the key. How do you do this? Because the one thing we haven't gotten a lot into is this has big implications for mental health too. Depression, stress, anxiety.
Right.
So there's a whole field of psychiatry now. Because I just came back from the national lifestyle medicine meetings, the College of Lifestyle, American College of Lifestyle Medicine. Nutritional psychiatry, how you can use food, lifestyle approaches to impact depression, chronic stress, anxiety.
Wow.
And so this hits every aspect of our life.
This is huge.
It's really huge.
And I've said before, I blame my parents. I'm gonna tell you why. You know where I'm going. Finish your plate. Eat everything in your plate. And my dad would tear a pig up. From the rooter to the tutor. Pig ears, pig feet. And so, my brother would tell you, we ate. We couldn't go nowhere until we finished our plate. And so I still battle with that. You know, if it's on my plate, it's getting eaten.
Yeah.
It's getting eaten. It's just how it is. And not even when I'm hungry. You see what I'm saying?
Yeah.
And so those type of generational curses, they're not the worst thing, but we still adhere to those principles even to this day.
Yes.
And so trying to convince the mind, you know, cut the meal in half, or you know what I'm saying? It's very difficult.
It is hard, and it's also how you prepare stuff, right? Like, because you can take some of the traditional dishes that are made. I just like how we traditionally cook green.
Right.
By the time you add all those different things in the greens, you know, you can cook it much healthier.
Yeah.
And it's been interesting. Some of the people who've gone through the healing program. It's really interesting. We've had one person. He was actually a grill master.
Oh wow!
But he went through and he's like, oh my gosh, man. Okay, I needed to change. So he just kind of shifted his focus, and he's made some of the tastiest dishes. Not grilling, but just changed the way he thought about everything. Right. We've had a number of people who just, once they understood what we were talking about,
right, they took
dishes and they just changed them.
Right.
You can still have good spices and things in there that don't have, you don't have to have a whole lot of salt. It has good flavor, and what you'll find out is your taste buds change over time.
Right.
So I just don't crave this. I don't crave the stuff I used to crave.
Right.
You know, even with coffee, I'll drink black. I'll drink black coffee. My coffee used to be a whole bunch of cream and sugar, and and that took a while. But now, if I add sugar in it just doesn't even taste right.
And so now it's a full lifestyle for you.
It's a lifestyle. Yeah, that's what this isn't a diet.
Okay.
And that's why I get. It's got to be a lifestyle change, right? Because we've all been on those diets, right? Where you do the diet and what happens? You do it, you might drop a whole bunch of weight, and then you stop doing it, and usually you end up gaining more weight back.
Absolutely.
Because it's a diet. It's got to be a commitment to a lifestyle change. That's why we stretched the program, the Heal Line, from just 90 days to more, because we knew people needed that extra support and accountability. And it works. I see it every day in patients. You can just see getting them off of diabetic medicines or cutting the medicines in half. Same thing with blood pressure.
Right.
The biggest thing is mindset. You gotta want to do it.
The mind is something else, man. It's brutal. It can be brutal. It can beat you up.
Yeah.
It's beat me up for a long time in so many different areas that I'm finally now. I'm telling my friend today, this is the best I felt in a long time at 55 years old.
Well, yeah.
Mentally and physically, this is the best I felt, and I'm proud of that. But I still have my days.
Yes.
You know what I'm saying? So talk about what's the most weight loss you've seen a gentleman have or female had in your program?
Well, we've had some people that are over 100 pounds. But here's what I'll say. There's a difference between weight loss and healthy weight loss, right? I mean, because you can go on a fad diet, drop a whole bunch of weight,
right,
and it comes. You want to take it off the right way with a lifestyle change. So it's not uncommon to see people maybe they'll lose 30 or 40 pounds. Then you may plateau out.
Yeah.
You may have to tweak things,
right,
and I talk a lot about the nutrition side, the food side, because that's important. And but then you also got to look at some other stuff, like exercise is important. And exercise can be as simple as walking.
Right.
So you ought to get up to 150 minutes a week of moderate exercise. That's the cardio. But then you also ought to get 2 days of strength training. And again, that doesn't have to be out pumping iron. You can get that kind of weight that you need just with floor exercises.
Yes.
With push-ups and
yes.
I mean, and the other thing is sedentary lifestyle. Like I spend a lot of time, like I'm sure a lot of the people do, sitting on the Zooms, doing this and that.
Right.
You should every hour or so for 5 minutes, so get up and stretch and move. So what I try and do now, if I'm on a phone call, and I can walk, I'll just walk around while I'm talking.
Right.
I'm about to get one of those desk, standing desk,
yes,
because
they're trending now.
We sit in front of. I mean, when I looked at the hours, I was thinking, and that sedentary, just lack of any kind of movement is a huge risk factor. So you got to add that in, and then sleep is the other really important one that is way underestimated.
Everything you said is achievable.
Yes,
is doable.
It is.
What do you think about the Ozempic and those type of medicines? How you feel about that?
Well, this is what I think. I think that they can help a lot of people. Here's the thing, and this is actually, if you look at a lot of the Ozempic literature now, they're even saying, even if you go on the Ozempic, you still need to have lifestyle. And here's why, right. Because let's say 2 reasons. One, if you're on them, if you ever stop those medicines, then the weight comes back. Right. But even if you stay on them, you can get what we call muscle wasting. You can lose muscle mass, things like that. So ideally, if you're going to use that, and this is my philosophy with kind of medicines in general, not just Ozempic, is if that's the way they can get you started and you do it, okay, but you get your lifestyle going, and again, the goal would be at some point, can I get you off of it? Can I taper you off and get you off of this? Yeah. And even if you stay on it, like I said, you need to be on it for the mass. So that's kind of what I think. And like I said, that's not just Ozempic. I do the same thing with testosterone medications now, because a lot of men are worried about their testosterone, and a lot of testosterone loss comes from belly fat.
Testosterone, I never heard of that. Testosterone loss. Speak on that for a
second. So testosterone is the major male hormone. It's responsible for another thing. It's responsible for your sex drive, energy level. It can impact your erections. But here's what people don't know about testosterone and all that. It's also very important for some of your chronic health conditions. So, for instance, hypertension, diabetes, being overweight or obese. All these can be linked to low testosterone to low testosterone. One of the when you go to the doctor, a lot of times you get your what's called the body mass index, or the BMI measure, right? Yeah. Now the thing is, the BMI can be misleading because you could be a very muscular individual and you have a high BMI. Right. Your real risk comes from your waist. So here's what you need to do. Here's my homework assignment for everybody listening: is get out a tape measure and measure yourself at the level of the belly button. This is for men and women. It doesn't matter who. And here's what it should be. That when you measure, it's not your pant size. Everybody wants to talk about pant size. Pant size doesn't count. It's what's hanging over the belt. So when you measure that, it should be less than 1/2 of your height in inches.
Yeah.
So if you do that, half your height in inches, that should be that's the bigger risk, because that is an indication of what we call visceral fat on the inside. Okay. So that's what you want to look. That can impact testosterone in men. It can impact hormones in women. But that's the thing. Lifestyle can impact that. Right. So I can raise your testosterone by helping you lose that belly fat. I don't have to put you on all these different medicines. And when you go on these testosterone medicines, the injections, like the thing. Your body starts making testosterone. So I tell the men, okay, when you go on this, right, your body's going to stop making it.
Oh, wow.
Because your body says, I got testosterone, I don't need to make any more. Right. There's a whole feedback loop. And so basically the signal coming from your brain to your testes saying make testosterone stops.
Wow.
Because the body says, I got enough.
But can it regenerate?
It can restart. But one of the things I tell people is, look, if you still want to have children, I'm definitely not going to put you on, because it can restart, but what if it doesn't? The other thing that happens is when you stop making testosterone from your testes will shrink in size, because again, it's when the testes are making testosterone that feeds that.
Laughing, please. That's not funny.
It's not. But I'm just telling people.
At people testes, Doc. What are you doing here?
But the thing again is, if you come into me and you're absolutely miserable with just tired, and your levels are really low, then I'm not going to say no, I won't treat you, because I will, to get you feeling better and get moved. But what I'll say is, at the same time, let's get going on this other stuff, because, man, what if 6 months from now, 6 months, I could get you off of this, and you don't need, so that's my approach now.
It's got to be an end game to this medication. It's got to be an end game.
Yep.
It's not going to last forever. Talk about the women. Do you get many women in your office about the same things that men go through, or do they have their own doctor that can help them?
So women have their own. Usually it can be a gynecologist. It could be a primary care, because there is a flip side to everything. Perimenopause, perimenopause. So no, I don't treat that. I'm a men's health specialist. So, but I can tell you this: a lot of the men. This runs in couples, as you can imagine,
absolutely.
Right?
Yes.
So if I'm seeing the man, I'll ask, what's going on with your partner. But they're specialists in that, just like they're specialists, but like I am on the men's side, they're specialists on the women's side.
Wow, the pressure of a man, it's just life. The progression of life. If you live long enough, things are going to happen.
Yeah.
You know what I'm saying? So you better get ready to make fun of it or make light of it, because you don't want to drive yourself crazy.
And women do drive. So a lot of the men, like I said before, I see in the clinic, they come in because listen, women take care of us and drive healthcare, right?
That's right.
How many times have you gone to see somebody because your wife or partner said you need to do this? And after a while, you're just like, okay, I'll just do, or they make the appointment for you.
Right. Oh yeah, absolutely.
Yeah,
absolutely. It just added pressure. I like this conversation. I really do. And I had you here because you know a lot. You know all about it. I'm not saying you know a little bit. You know a lot about it. And our men need to hear the percentages.
Yes.
We need to know that, hey, black men go to the doctor more than white men, and percentages or whatever you said they were higher for black men. What can we do besides education? You have your program, we have a podcast.
Yeah.
It seems like it just boils down to, the man has to make a decision at some point.
You do have to make a decision, and that's
a life or death decision in some cases.
It exactly right.
Right.
It can be life or death. So some of the men who have more serious problems, whether it's cancer, diabetes, other things. This really is like, this can help you get control. Maybe you aren't being well controlled with medication. With men and women, but my practice is men. The ones that come in who are on the I don't know if I should say sicker, or they're just fed up with being sick.
Right.
They're just like, you know what?
Tired of being tired.
I'm just tired of this stuff.
Right.
Doc, I do not want to go on another high blood pressure medicine or another medicine for my blood sugar, diabetes. And I'll say, well, look, and I'll just say, so how are you eating? What are you eating? And then usually I'll say, oh no, I eat pretty good. I get some salads and I do this and I don't eat that much beef, but I eat a lot of chicken and a lot of and I just but David, that's where the education comes in, right?
Exactly.
You just have to know, okay, I listen and I say, okay, well look, the difference is where you get your protein from. The protein that you get from the plant-based side of stuff is packaged in a healthy way, as opposed to animal-based protein.
But how do we find out the good fake meat or fake food? Everything is convoluted, so to speak.
Yeah,
even I saw where Whole Foods have been challenged about their the food that they produce. It's like not being what they say it's going to be.
And that gets back to my point of whole food, right? You can make a like kind of a black bean type burger and this and I'm gonna tell you it can taste to me just as good as a regular burger. Now they do have the some of the meat alternatives and
yes.
It's funny, we had a big discussion about that at the lifestyle meetings, and the way people look at that is it can be an intermediate step. Like, is it better for you than just going out with regular and yeah, maybe it's kind of like meeting people where they are.
Right.
That's how I utilize that. But then I'll say, but you know what? Look, I can make you a whole grain type thing that I can make it taste just as good for you.
Mm.
You gotta be willing to try it. Some people just won't even.
Oh no.
They won't even try it. But I tell you what's interesting, and Tony talks about this all the time. You go to a cookout, and a lot of times we'll bring our own dishes just because I don't want to eat the regular stuff. And you start bringing them, and you start putting them out, and people start tasting it.
Yes.
And it's good. And the next time, you go in there to get some of the food, and it's all gone.
Right, right. People just don't know they're afraid. Again, generational curses. A curse is maybe not the word, but since we were little, we eat bacon, chitlins. My brother is putting 2 10-pound buckets of chitlins in my freezer downstairs. I don't eat chitlins, but he's doing it for the new year. He can't wait.
It's hard. The hardest thing for me to give up were the eggs.
I gotta give up eggs. I'm an egg.
Dairy, eggs, inflammatory, dairy products.
Yeah.
That was the toughest thing for me because I used to just love that. Now there are different things we can do that actually, again, it actually tastes good.
I eat eggs every day.
I know.
I eat eggs every day.
It's hard. That was tough. Changing from I used to drink a lot of milk when I think it was 2%. What again is dairy, but now I've changed to I'll do more soy based milk or other and people say, oh, but soy that gives you estrogen. Well, soy creates what we call phytoestrogens that can actually be healthy for you. But yeah, it's the battle of the taste buds, and but that was for me that was the toughest. That was hard.
Doc, I eat eggs every day. I do. I have 3, maybe 4 scrambled eggs. I have a hard boiled. You know what I'm saying? I love eggs.
And it is. I rarely, but I just.
You know too much. You know too much. It just ain't. If you knew what I knew, you would be doing it. Right?
Yeah, exactly. With that. So, but that's why I say you try and meet people where you are, because here's the real reality of it is. The reality of it is if you take the standard American diet. So if you look at the standard diet people are eating, if I got you to do 50% of the stuff to start out, what we've been talking about,
right?
That's a huge that'd be a huge change. And if I get you to that, then I can get you to go to 75, and because I know your taste buds are going to change. You're going to start feeling better, and you start feeling better. All of a sudden, it's like, oh, okay, let me keep doing. Yeah, this wasn't as bad as I thought. But the trick I found is to meet people where they are, and then figure out where is your mindset. So one of the questions I always ask people, when they come in, I'll say, are you serious about your health, or are you curious about your health? Because especially with a lot of men, because they're sitting there like, oh, I don't know, I have time, and men always say they're serious because we never back down,
right?
And then I'll say, okay, so are you willing to face the things that are really making you sick? And that makes them think a little more,
right?
Because they're like, but then we're men, we're not going to back down.
That's right. That's
so
right.
Right. So then I go, okay, so let me ask you this one last thing. Are you ready to make a change? And when are you ready to start? And that's where the rubber hits the road right there, right?
Right.
Because if you tell me, I'm a year away, I know, okay, well, you need more education. But most men, a lot of men, they'll either say, I'm ready to do this now within the next month, or they'll say, what I hear a lot is, I've been trying to do this.
Right.
I just don't know what I'm doing.
Right.
Right. I'm trying to eat better, but I don't know. Those are the ones that I know there's a high probability I'll help you because you got the mindset to where you're ready to do. You're fed up. You're fed up. Yep.
You're fed up.
Yep.
That's Doc. Thank you. Thank you. I appreciate this because this is some information that I've been wanting to give my people out here. I ain't gonna say fans, but my people out here. Fans is coming down the road, okay? But I think we're in a space now where we're more health conscious.
Yes.
At least we're talking about it. We have
Yes.
a conversation about it. And I see some of my friends that they got some size on them, they got some age on them,
Mm-hmm.
and I want to have some information to give to them. But they suffer from some generational stuff as well. You know what I'm saying? They've always eaten a lot.
They've always
done it. You know, you go down to Memphis where my mama from, they always eat.
Yeah.
They always
Yeah.
eating. It's just a rite of passage. You know what I'm saying? And so, but on the flip side, I have friends like you and Tone and my lady friend who's a vegan and really has gotten a grasp of the lifestyle. You know what I'm saying?
Yeah, and again, when you meet people, so because people get afraid when you say vegan. That's why I say kind of plant rich because what I'll tell you is this is it really depends on where you are when you come in and you know some of the sicker patients I'll just say look okay we're going to meet you where you are but I need to rapidly transition you to where you're pretty much you know eating whole food plant based because you need your body needs to heal. And then we can reassess. So you got to do that. And the other thing I tell people is you got to give yourself some grace too, right? I mean, you didn't get here overnight.
I know it.
And to think you're going to be, unless you have a certain mentality, like I had the mentality, that's just the way I am. I was just like, I'm going to go, now that I'm convinced, I'm going to go do this. And some men have that mentality.
But the social media craze, you know what I'm saying?
Yeah.
The social media it points out the highlights.
Yes.
Everybody's fit.
Yes.
Everybody got good credit.
Yes.
Everybody make good money. And so that influences you. It makes you feel some kind of way. It's like cyberbullying without actually bullying you.
Yeah.
You see what I'm saying? All you got to do this, in 2 weeks you be fit, and then you get into it, and you sprint real fast, and then you quit.
Yeah.
See? And so I like how you and Tony are pushing lifestyle instead of a diet.
Yeah.
You know what I'm saying? So lastly, I want to thank you for coming here, okay? I'm going to give you the camera and just explain where you are, how to get in contact with you. You're always looking for new patients, I know.
That's what of course we can.
Yeah, we need some more. He got bills. We got to get him.
Oh, man. No,
we need to get some people to come and listen to him because he's going to tell you the truth. He's pushing for black men and men in general, not just to get in shape, but get into mental shape.
To get into mental shape,
right?
You know, physical shape, and with lifestyle as a push. So I am you know, Dr. Kevin Billups. I am a professor at Meharry Medical College. So I'm here in a town. The lifestyle group that I've been talking about, working with, is called Meharry Health Network. It's part of the Meharry family. And I don't know, you know, David, probably I can get you some of the locations in Nashville. We have 4 locations in Nashville. One's in Cool Springs. One is in Antioch. One is in East Nashville, and there's one out in Murfreesboro. And then we have 4 locations in Memphis. And I'll get those to David along with the contact numbers. I also see patients over at Total Health. In Antioch also, but I'm really looking forward to this. We call it the restorative health model, which is just a fancy way of saying that we're gonna bring these lifestyle things that we're talking about into how we can help men and women. So this is men and women help manage chronic disease. So why do I call it restorative health, people instead of preventive health? Because when I see you in the office, prevention it's not about prevention at that point, right? You're sick. It's about, can I restore you to some form of decent health, get you to maintain that better health, and then prevent you from getting sick again.
Right.
So that's why we call it restorative. So yeah, I'll get you all the firm information, but yeah.
Firm information.
Maybe that's a bad.
Yeah, that's bad.
That's okay.
Come on, doctor.
all the accurate, detailed
Yeah,
information.
you can't say firm and be, erectile dysfunction. Just come on, doc, you know better.
Oh,
Well, God, thank you again for coming. I love you, man. You're one of my good friends. We go back 4 years, man.
Yeah, we're on the line together, man. There
That's
you
right.
go. That's right.
And it's
That's
been a
right.
blast. It's been something else. It's been something else. Thank you, guys. This is season 2 of the High Table, and we'll be checking in real soon. Have a good day, guys. Bye-bye.
All right. Night, everybody.